My name is Christine Fairfax. I am the lead occupational therapist for adult mental health in Swansea and part of the Swansea Bay University Health Board. Today I am going to present telephone intervention in adult mental health, delivering symptom management to enable occupation. Okay, just to give some context, this is a brief overview of the challenges adult mental health services experienced from March onwards and the impact of the pandemic. Adult mental health services are traditionally made up of face-to-face contact with all members of the multidisciplinary team using this type of contact. For OTs, we use it to support service users who have complex needs, many with high levels of risk, to meet their recovery goals. We provide planned interventions which encourage inclusion and increased proximity in the local community to reduce the proximity of services to the service user and manage risk. Adult mental health services work closely with outside organisations and took advantage of this during the early days of the pandemic and used established partnership working to meet basic needs before returning to a more focused therapeutic intervention. So how did telephone intervention become the therapeutic vehicle? Well, telephone contact became the main tool used in the continuation of intervention and the assessment of ongoing risk, and assessing any new risks that may have arisen for most of the members of the MDT. For OT, we found it particularly useful as a way to deliver interventions successfully. To give it some context, I am going to base my example of its use within the assessment and home treatment team and the OT team based there. For those who may not be aware, the assessment and home treatment team is multidisciplinary in nature and uses short-term intense intervention, focusing on the individual's needs, which emphasises the principles of recovery and well-being. The OT model of working within this team is based on providing one-to-one and group work with a focus on removing the barriers that exist for that individual to recover engagement in occupation and improve their mental health. This could be re-establishing their occupational identity, their responsibilities, their roles, and exploring leisure, self-care and productivity occupations. The greatest challenge, therefore, in continuing the therapy and the intervention were the societal restrictions and trying to think quickly outside of the box rather than the usual way services would be delivered. So the team set about trying to solve this quickly due to the nature of the service and how timely the intervention needs to be with this group in particular due to the acute risk. The OT team found their service users typically experienced anxiety, low mood and unhelpful thinking patterns as a barrier to occupation, which could be improved with anxiety management, mood management and relaxation, mindfulness, and the establishment of a wellness toolkit to support service users in their recovery of occupation. The solution Gemma Gordon and Alice Pickford found was to produce easy to follow information packs based on these typical barriers. The service users could have posted to their home and for the OT to go through with them on the telephone to provide examples, demonstration and application of the tools as a therapeutic intervention. This was to meet the OT goal of removing barriers in order to facilitate occupation and help their recovery. Each pack contains skills that are transferable, so they can not only meet the short-term needs of the crisis, but also the possible longer-term needs of maintaining their wellness. So why do we use these resources in mental health? I know some of this would be very familiar, but I thought in the interest of giving some context about the handouts, I will briefly go over this. So the use of anxiety management and low mood management in OT is to equip individuals with skills to enable them to engage in occupation. The booklets themselves and the skills within them target those individuals who see anxiety and low mood as a barrier to them engaging fully in occupations that are meaningful to them and to engage consistently to maintain their well-being. So to give you a bit of a visual of the packs themselves, the Anxiety Management Pack attempts to combine all of the traditional resources in one place, in that the OTs in the assessment home treatment team would use to manage anxiety, such as information about anxiety itself, what contributes to it, how you would commonly feel, all the way through to some strategies that an individual could use following reading through the resource. Simplified language is used within the booklet so that it doesn't overcomplicate the subject, which those experiencing anxiety may find overwhelming already. This also makes it easier to use on the telephone so that you're not trying to explain complex concepts to someone who may be unable to maintain their concentration. It also has natural breaks within the booklet so they can be read in sections. So for example, there is a section on what is anxiety. It then moves on to unhelpful thinking habits before finishing with helpful techniques. Within the booklets, we have tried to move away from website links so that it doesn't depend on a member of staff having to review the booklet continuously if the links are moved or if they don't work anymore. Instead, credit has been given to the subject matter within the footer of the booklet so that there are links there which individuals are able to research, but because they exist as references, they do not need reviewing and can stand alone. Here is an example of some of the pages of the booklet. This is a coping strategy that individuals can take away immediately and begin using within their day. Both the stop technique and grounding technique are widely used in mindfulness, but both are useful in removing barriers that prevent engagement in occupation. I've also included some information about the low mood booklet. It also attempts to combine common resources that are used to manage low mood, including information about low mood, what contributes to it, and how you can make changes to improve your mood on a daily basis. Simplified language is also used within this booklet, so as to not overcomplicate the subject, but giving enough information so the individual is able to have a basic grasp and understand some basic tips and changes they could make immediately to change their circumstances. This booklet also has natural breaks within it, so it can be read in sections. So for example, it starts with triggers of low mood, then looks at unhelpful thinking habits, before looking at changing behaviours and coping strategies, and finishing with the effects of food, exercise and sleep on mood, and combining this with solutions. Again, the booklet shies away from website links so that it doesn't depend on someone having to review the links themselves, but it also gives credit within the booklet regarding the subject matter, so again, the website links are standalone. Again, here is an example of some of the pages of the booklet, giving some information about how it affects mood, before giving some simple solutions that an individual can apply directly to their lives. So, how successful has it been? Well, initial verbal feedback from service users has been positive. They have fed back that they are appreciative of the time and the effort, the discussion alongside the packs, and the demonstration of the techniques over the telephone, which they have then implemented into their day-to-day routine. Service users have benefited from this intervention with the timely discharge from the service, and this alternative way of delivering therapy has not interrupted the discharge. The staff themselves also reflected on the change. They feel that service users' needs were met in a timely manner, and from the feedback, service users have had a positive patient experience. I myself reflected on the use of the packs, and I feel that they do not only help the service users, but they also support the staff to maintain their well-being, as they're able to fulfil their role and meet the needs of the service user despite any changes that occur in society. Overall, I feel the adaptation of the OT team demonstrates that telephone intervention can be successfully used to allow service users to recover their occupation, their function, and support their recovery. So moving forward, the potential challenges to mental health services have been well documented, and I have included a quote I found from the Mental Health Foundation, which discusses the potential long-term impact of the pandemic on mental health. All areas are considered vulnerable, but with those who are carers, those with vocational needs due to unemployment, and also those who have experienced a bereavement could possibly be considered the most vulnerable. Any plans to move forward with how services meet these needs need to be considered by the NHS as a whole, and with any changes being shared and adapted to meet those needs quickly and efficiently. Thank you very much for listening.